thrilled to have you here, and we hope that you leave with the fire that brings all of these panelists to this work. I think once you hear about their experiences, you too will be a social prescriber. So I am a family physician. My name is Dr. Alan Siegel, and I've been practicing in a community health system in Contra Costa County for Northern California for about 25 years. I'm retiring this summer from this role and exploring how to be able to do social prescribing as more of my work. During the last 12 years, I've been running an arts and health program and was a founding board member for the National Organization for Arts and Health for the last 5 years. But in my work, I've done a lot that would be called social prescribing, including extensive work in the arts. I am addressing social determinants of health and started a program called Health Leads in the West Coast, and a powerful parks prescription program where we brought kids with pediatric obesity to some of our regional parks. We had a naturalist, we had Zumba, yoga, Tai Chi, we had healthy food, expressive arts, we had live music. And that was one of the more powerful experiences I have had. And then I keep hearing about it from patients for many years about that was really an incredibly powerful moment for them. So I think that's kind of what we're talking about here, is building community. But I would say that my most important social prescribing is really my everyday experience over the last 25 years, working with patients with anxiety and depression, and yes, loneliness, as we are now recognizing, and figuring out how to help them heal. They would tell me things like, I love drawing, but I don't do it anymore, or I love to dance, I love to be out in nature, but depression and anxiety often drags people from doing the things that they love. So I would push them back to do those things, and we would often end up in tears as people are like, wow, yes, I need to do the things that I love. So with social prescribing, I think we have the opportunity to engage our patients and ourselves and to figure out what are those things that bring us passion and help us heal from the wounds of life. And then we need to help them make it happen through a program. Social prescribing is a more holistic approach to wellness and health that brings many new tools to the hands of health professionals, tools that are closer to the heart and souls of their patients. The role of the link worker is critical, or in this country, often called a community health worker. We need that intermediary who can help guide referrals in a patient-centered way. And in social prescribing, we help patients engage in the arts and nature, volunteer to be part of community groups, and address social determinants of health, which is really, when it comes down to it, what drives most of our health. What we do in the clinics and hospitals is actually a small part of health, but all that social determinants is super important. So as one of those providers, I don't want to increase the work of the health professionals or give them lists of community resources that patients need to explore themselves. That is not social prescribing, and it doesn't work. So by doing this well, we can help rebuild community, help individuals heal using all the tools. We need to have consensus on what social prescribing is. There's a new international definition and framework for social prescribing that we support at Social Prescribing USA, and we really want people to be talking about the same model. So there's a link to that in the chat. Arts and Prescription, which we're all here to hear more about, really provides a framework for developing social prescribing programs using both arts and nature, and is a wonderful resource that I have used, and I hope that you all get to take a look at it. I founded Social Prescribing 2 years ago, and we're mostly an advocacy organization for social prescribing and really trying to get it adopted across the country. We see our role as bringing the 9 different sectors around social prescribing together to be able to bring on programs and different ways of doing. We have a growing community of practice, which I would invite you to join. There should be links in the chat, or you can send an email to us at socialprescribingusa@gmail.com if you want to be part of the community of practice. We have a newsletter that we keep people updated. There's so much happening in this space, so we're trying to keep people up to that, and soon we'll have an updated website to keep people updated as well. Right now, we're planning 1 month from tomorrow, our first ever celebration in the United States of Social Prescribing Day in San Francisco, and we're also supporting about 15 other cities around the US through our community of practice. We invite you to have your own celebration, whether it's doing PR and sending things out through some of the social sites, and really get the word out about social prescribing. And definitely please let us know if you're interested. We're linking some of that up and probably going to have a synchronous webinar as well that day. So today you can see the objectives in the chat. We're going to share with you about social prescribing. We're going to have Tasha talk about the Arts on Prescription field guide, and then we're going to have some wonderful panelists where we can gain a lot of insight about programs, how they run, how they built, what kind of problems they have. So we'll have some opening remarks, Tasha joining us with a field guide, and then about a half an hour of a panel. All of it is moderated. As I mentioned, all the resources and links will be dropped into the chat, and then we're going to send them all for the webinar replay by the end of the week. So now let's get started, and we have a surprise guest.
Great, thank you, Alan. Hello, everyone. I'm Dr. Jill Sonke, Director of Research Initiatives in the Center for Arts and Medicine and co-director of the EpiArts Lab, a National Endowment for the Arts Research Lab in partnership with Dr. Daisy Fancourt at University College London. I'm really thrilled to be here to welcome you this afternoon. This is such an exciting moment, and I think your presence today, your numbers are evidence of what an exciting moment it is for the exploration of social prescribing and arts on prescription in the United States today. As you'll hear about today, there's a lot of really beautiful innovation happening in this space. And it's a moment when we know that in our healthcare system and in our approaches to health and well-being in the United States, we need the partnership of arts and culture and of local resources that can be brought to bear to support social connection and well-being. So I'm really excited about all of the amazing programs and people that you're going to hear from today. I hope that the field guide is useful to you. I think it's a very timely resource. And we're proud to have partnered with Dr. Tasha Golden in the creation of the field guide. So I just wanted to pop in for a moment to welcome you all, to thank you for your participation, for your energy, for your innovation and creativity as we explore this moment of ideation and possibility around social prescribing and arts on prescription. Thank you so much, Alan.
Thank you, Jill. It's great to see you. Sorry about that. Tasha Golden is Director of Research at the International Arts plus Mind Lab at Johns Hopkins University. She's a national leader and consultant in arts plus public health. She has a PhD in public health sciences and has published extensively on the impacts of the arts, music, aesthetics, and social norms on health and well-being. She has served as an advisor on several national and international health initiatives, is adjunct faculty for the University of Florida Center for Medicine, and there she is, and recently led the pilot evaluation of CultureRx in Massachusetts, the first arts on prescription model in the US. Dr. Golden is also a career artist and entrepreneur, and we are honored to have her today. So, Tasha.
Oh, thank you so much. I am so excited to be here, you all. I'm so excited to see list of people in the chat, some of you who I know and have been honored to meet, and others that I hope I get to meet sometime. It has been such an honor to lead the development of this field guide, and I'm so excited to tell you just a little bit about it now. So I am sharing my screen. Let me know, somebody, can you unmute on the panel and tell me that, make sure that you can see this okay before I keep going?
I see it. It looks lovely.
Thank you so much, Natalie. All right, we're going to just jump right in. I wanted to start with this question for you all. And since our chat is beautifully enabled now, assuming it's more than the absence of suffering, how would you define well-being? Be a few words, a sentence, but we'd really love to hear from as many of you as possible to drop this into the chat. How would you define the term well-being? What the heck is it? And I will give you a chance to get started on that, but I'm going to dive right in as well. So keep dropping it in the chat. We'd love to hear from you. And then meanwhile, I'm going to talk with you about arts and prescription through the lens of this guide. If you don't have it yet, please be sure to download it. Once the chat storm is over a little bit, we'll make sure that the link to this guide is there in the chat for you to grab it. And then let's just back up a little bit, like how and why did we write a guide to arts and prescription? And to tell you about this today, I'm just going to tell you a little bit about how and why I'm here at all. because I come to this work from a career as a singer-songwriter. This is the job that I dreamt of since I was little. It's the job that I thought I would have until I died. So how did I wind up here doing this work at, the International Arts and Mind Lab and with the University of Florida? I had songs about difficult experiences, like my family's history of domestic violence or my own history of major depression. And no matter where we went in the world, those were the songs that people lined up after shows wanting to talk about. So over the years, hundreds of people have shared really personal stories with me about abuse, about mental illness, suicide ideation, often following up those stories by saying that I'm the first person that they had ever told. And that has been one of the absolute honors of my life. But it means that they had never told a doctor or a therapist, not even a spouse or a partner, right? It means that the community services and the healthcare services designed to meet the needs of people with these kinds of histories had clearly never reached these individuals, right? And at the time, it was like, oh, I'm so glad that people are talking with me, but also this division between these arenas of our lives isn't helping us and maybe doing harm. Like, how do we bridge the gap between what's possible in the context of music and what isn't yet possible in these other contexts? And this came up again when I founded Project Uncaged, a trauma-informed creative writing program for girls that are incarcerated. And you all won't be surprised to hear that girls share really different information in their poems than they share in conversations or even surveys. And that information is relevant to how we support them and the resources that we may need to provide for them. So again, every day, there are people making decisions about young people's lives without having adequate knowledge about those lives, because there are things that young people may only share in the context of creativity. So what do we not know? What are we unable to address? What solutions have we been missing out on because we've been slicing up the human experience into sectors that don't work together? And how are we going to reintegrate them? I wound up with a PhD in order to get some answers to these questions, and it's what drove me to the work I do now, which is so much about helping organizations think and collaborate across our disciplines and sectors so we can do better work and do better by our communities. And this leads us to here, right? Imagining how we reintegrate sectors. I will say that a lot of people hear these stories about people sharing things with me after shows or in creative spaces, and their immediate response is like, yes, the arts is so important. This is why we have to expand access to the arts. And they are not wrong about that, but we need more than access. If you think about it, if every young person in the justice system had access to creative writing class every day, that would not mean that the knowledge they're sharing in those spaces is reaching the people who are making decisions about their lives. And it wouldn't mean that those decision makers want and value that crucial knowledge, right? So we have to imagine how to partner, how to connect and reintegrate across our sectors. We have to reimagine our relevance to each other. We have to bridge this gap, right? We advance well-being not by hyping the value of any one specific sector, but by questioning our separations and breaking down the silos and bubbles that keep us from benefiting from all that humans know and can do across our various sectors and disciplines and industries. Because we are whole people and we have whole community lives and needs. A better system, a more effective and a human system, requires what I call a fabric of community care that draws upon all community assets that benefit health. And that's what arts and prescription is really rooted in. Not in arts, not in healthcare, but in the concept of creating a fabric of community care. Our contexts and our communities affect us so much that the science tells us that your zip code can determine your life expectancy. So as we consider this fabric of community care and the role of the arts in it, we start with understanding the social and structural drivers of health, and we go over these in the field guide. These include education access, healthcare, the neighborhood and built environment, our social and community context, economic stability. And within these, things like clean air and water, safe and affordable housing, transportation, food access, social norms, oppression, access to resources, and yes, arts and culture. Given the impacts of all of these drivers of health, it was never going to be possible to create health inside a clinic or inside any single community program, because health is made possible by health-conducive contexts. It's a full, contextualized, community-created phenomenon. The WHO defined health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. This is the definition of health that the field guide is based in. And so, yeah, health is not just the absence of disease, it is the presence of well-being. And I asked you all about this earlier, assuming it's more than the absence of suffering. What is well-being? And when you really dig into people's answers to this question, you realize that most of them fall under the umbrella not of healthcare, but of arts and culture, which means that arts and culture are fundamental, even intuitive aspects of health. But despite the WHO's definition of health, well-being hasn't gotten all that much attention in health fields, and we haven't had many ways to provide for it. So Arts on Prescription offers a way into this essential work. And we've heard from providers in Arts on Prescription programs reporting that they're glad to finally have tools in their toolkit to help them address things like quality of life, social connection, hope, meaning, curiosity, interest. These factors that we know are protective and supportive in the midst of our health concerns, and that we know make it possible for us to be well, not only not sick, not in pain, but also well. Yet before this kind of program, most providers have not had a way to address those kinds of factors, just as Dr. Allen said earlier.
Is this novel and weird? And I want to speak to this too. No, actually, it's grounded in social prescribing, which Dr. Allen mentioned earlier, which has been practiced in many countries going on for decades. That practice of referring patients to community resources that support their health. Social prescribing is really the umbrella practice that Arts on Prescription falls within or under. It is not novel or standalone. It's part of a larger effort to improve health. And in the US, we do have non-clinical community referral practices in most communities. We don't call it social prescribing, but many providers have some way of referring their patients to some resources in the community to help meet their needs for like housing or food assistance support groups, things like that. And obviously, these processes vary a lot across the US, but community referral is something that we already do and value. And Arts on Prescription literally fills gaps in those referrals. Essentially, if your community has health benefiting assets, and we know that arts and culture and nature are health benefiting assets, we can't afford not to tap into those resources. There's no reason not to improve health and healthcare, potentially by using some of the same processes that providers are already using to make community referrals. So we're not talking about something wholly new. We're filling in a fabric of care that's never been complete. Arts on Prescription aims to advance health equity, making it more and more possible for all people to thrive, to have access to the experiences that allow us to be well. So this work is most successful when we hold diversity, equity, inclusion, anti-racism, and access as core values from planning all the way through scaling. Research shows us that bias, discrimination, and oppressive practices persist in healthcare. They persist in the arts sector. So we have to plan to actively counter them. Like they're not going to just take care of themselves, right? So the guide shares practical ways to do this to ensure that we can not only advance equity, but do no harm. And this work is community-centered and user-centered work. It really has to be because it draws upon and cultivates culture, identity, meaning-making, connection. The disability rights community gave us the saying, nothing about us without us. So we ensure that those who are most affected by a program are the ones who are shaping it. We lead with what the community says that they want and need and value. And the guide offers a lot of tools to help you all take this approach in your work. Wraparound care is some of the most creative and collaborative work in health in general, and truly weaving that fabric of community care. So you can imagine having a ticket to a theater performance is useless if a person can't get there, or if they don't have childcare, or maybe they just don't have time between work and the show to come home, cook a meal for the kids, drive to the venue, right? So wraparound approaches identify these potential obstacles in advance and build solutions to them into the program. It can get so creative, and it's another reminder that our health is affected by our contexts. No single sector can solve for health, not healthcare, not the arts, not even the two in combo, right? We need a full fabric of community care. In the field guide, you will also find a full chapter on evaluation, because this is such a question mark for a lot of people starting a program like this. How are we going to assess it? And I want to say, evaluation is more and other than people tend to think. It's more creative than people expect. I love helping organizations realize this. It's also a part of community-centered work. because the people who are served by programs deserve to know whether that program is working as intended, right? Whether it could be improved, whether something else might actually be better. And so evaluation, you will find that. And as you might expect, a big portion of the guide is about the practical hows of program development. So we run through these 4 key questions that you see on the right. What are the engagements that you're going to offer people or refer people to? What evidence do you have to support the ability for those engagements to address the specific health concerns you're looking at? How will you create the partnerships that you need to get this moving? How will you set up systems to make it run? If these 4 questions seem daunting, this is literally why we wrote the guide. So we walk you through each one of them and provide, like I've said, an absurd number of appendices to give you so many resources to help out. And I mentioned partnership. I will say this is one of the greatest challenges in arts and prescription. Not knowing how or with whom to begin keeps a lot of great ideas from ever turning into action. And a lack of preparation can make even the coolest partnerships fall apart. And one of my favorite things is helping organizations create partnerships that grow their work. So I can tell you there are tools and frameworks to prepare and to make the process clear. You can do this work. What I do not suggest, is that you wait for someone else to come to you and initiate something. This guide is for you, this work is for you. It's common to wait, and it's a real defeater of great opportunities. You'll hear from people who had a vision today and worked to drive change. So if you can imagine your part in this work, you don't have to wait for permission or an invitation. You can start where you can. And the guide is full of practical guidance and resources. I made reading guides even for the guide, so you can get the most out of the guide. You can grab these. I think there should be a link in the chat to get these free supports also. There are people like me who help ideate and strategize. There are ways forward. You can reach out for help and do this work. And that is where I'll leave my time today, that you can do this work. You can start where you are. You can start with a single partnership. You can weave a fabric of community care. This panel is going to give you lots of ideas for doing it. And to leave off with Baldwin, the world is before you, and you need not take it or leave it as it was when you came in. Thank you all. If you want to reach me, you can screen grab this. And I'm so excited to turn it back over to Dr. Allen and the panel.
Thank you very much, Tasha. That was, as always, very inspirational and filled to the brim with lots of great ideas. And I would just emphasize the last point I think that you made, that, you don't need to wait to have it all worked out. Just start part of it, start developing relationships with communities. Just there's so much to do. So I now have the honor of introducing our panel. So first up is coming Vanessa Ford. Vanessa is the Associate Director for the Community Music School of Springfield, Massachusetts, which is part of CultureRx. She is the founding director of Trust Transfer Project, a community-based initiative partnered by Springfield Cultural Partnership and CMSS that mobilizes local artists to create inspiring works of art to improve community health and wellness. Under her leadership, the program's mission is to elevate artists of color, create opportunities for equity, and promote innovative and culturally relevant artistic projects that bring hope and healing to the community. We are so happy to have you here, Vanessa. Welcome.
Thank you, Dr. Allen. Thank you. Hi, everyone.
Next up, to join us, we have Crystal Shakespeare. Crystal is Program Manager of the Arts and Wellbeing at NJPAC, or New Jersey Performing Arts Center. She's been a professional advocate with over 12 years of launching and running complex social impact programs for nonprofit, startup, and corporate organizations within youth development, arts and culture, wellbeing, and technology sectors. Welcome, Crystal. We're really happy to have you here.
Thank you.
And our last panelist will be Lauren or Lo Hauser. Welcome. She currently serves as the director of Project Jericho, which is a program of Clark State College in Springfield, Ohio. We have 2 Springfields represented here. Project Jericho is a nationally recognized multidisciplinary arts program that makes in-depth, meaningful art experiences accessible to high-risk youth and families. She believes in the transformative power of the arts and leads with an emphasis on empathy and relationships. She advocates for using the arts in a child and family's journey to thriving. And I love every part of that. So welcome. It's really amazing to be with all 3 of you. So Yeah, let's start off with let's start off with Vanessa. Can you give us an overview of how your organization implements arts on prescription and how did you come to this model?
Thank you so much, Dr. Allen. We had the opportunity at the Community Music School of Springfield to see the need in the community to offer a dance movement class. And it simply was about let's get moving. And so through funding from Mass Cultural Council, we had the opportunity to really fit a need and to fill a need in the community that people were saying, number one, we want to get together because we're lonely, feeling depressed. We're not connected after being isolated for so long. But I would love to just see some friends and get together and just move. And so we decided to offer a class that was very low risk, but intense in terms of making the human connection possible twice a week for 1 hour. And so we developed a program that we were able to really expand. It started out with just 10 or 12 folks a week and now has grown to about 50 participants per week. And we realized that through offering the opportunity to make that human connection, to have opportunities for folks to come together and talk about their anxiety and their stress levels, to really have a chance to just get moving on every level. Folks had an opportunity to get moving from a chair or in full range of motion, dancing with no dance experience required, of course. We found that the benefits of this program were amazingly measurable. We were able to establish a set pattern of folks tracking their blood pressure and that it was going down. We had folks saying that I'm no longer depressed, I'm no longer feeling anxiety. I love the human connection that's happening here. And we decided that it was something that we needed to share in the community because we want to build cross-sector partnerships. So we reached out to organizations to see who would want to partner with us. And we reached out to our health partners and our physicians in the neighborhood and said, we would love for you to partner with us on this. And we think that this will move the needle on how we prescribe improving health and wellness for our community members. And luckily, we got some physicians on board. They began to change their mindsets on how they prescribe being well and how being healthy could mean multiple things that sometimes are therapeutic, and the arts has a way to heal. So we've been successful in that because I think our program has the benefit of really being able to improve the health and well-being of people in our community. And that trickles down to our families and it makes our whole community a healthier community for everyone to live and thrive in. So we're thankful.
Thank you very much, Vanessa.
Thank you.
Well, why don't we hear next the same question for Crystal?
Thank you. Well, NJPAC launched our CultureRx program in July 2023. The program is made possible through intentional external partnership with Horizon Blue Cross Blue Shield of New Jersey, Rutgers University Newark, and Newark Art Organizations, and also internally with our Salesforce team. From initial roundtable gatherings with local health anchors like Horizon and RWJ Barnabas and art organizations like our library and Museum of Art, we entered a year of co-planning in July 2022, which enabled us to launch a year later. We're always learning and looking for ways to improve. When a Horizon case manager or Rutgers staff or faculty member sees a member or student in Newark or Essex County that has needs like loneliness or isolation, caregiver status, or mental or behavioral health needs, they can refer them to CultureRx. For students, the referrers can help them sign up together directly. For Horizon, the case managers can provide them with information on how to sign up via email, phone call, or text message. And then the participants sign up via quick digital intake form. So once the participant completes that intake form, they automatically receive a link to a longer onboarding form. They're also placed in our CultureRx queue in Salesforce. So often an NJPAC employee called an CultureRx connector will work with the participant to fill out their intake form and onboarding questionnaire. These forms allow us to help us learn more about the participant accessibility needs and any particular art activities they want to explore with us. The onboarding questionnaire also includes a baseline well-being measure. We use the flourishing scale. Participants are also reminded that ArtsRx is completely free for them. Their participation will last over 6 months, and they can attend one art activity per month and bring up to 3 additional guests with them. Once we learn about the participant holistically, a matching process begins where our ArtsRx connector researches arts and cultural activities that are available at our partnering local art organizations and sends 3 to 5 activity options for the participant to choose from based on their interests and their needs. And then once a participant selects their art activity for the month and tells us how many guests that they're bringing, our ArtsRx connector books that art activity and sends them a confirmation message via email and text message about their book activity, where to go, and what to bring to enjoy themselves. This matchmaking process happens 6 times. And we have participants complete follow-up surveys as well while they are with us about their art activity, whether they want to change their art activity or stick with the same art activity for the next month. At the 3 and 6 month point, we have them repeat their flourishing scale so we can capture and measure any changes the participant has in their well-being over time. We track attendance, adherence, the types of activities that our members select, like participatory versus observational, modalities like visual arts, dance, literary arts, crafts, and demographics using a customized Salesforce module. All costs are covered for our ArtsRx participants thanks to the support of RWJ Barnabas Health System, Horizon Blue Cross Blue Shield of New Jersey, Women at NJPAC, and other founding supporters. Thank you.
Wow, that is amazing. And, as we mentioned before, the patient-centeredness about what you're doing is just so important. So I think you'll hear that theme throughout all these social prescribing programs. Lo, would you like to share with us as well?
Yes, thank you, Dr. Allen. We arrived at this work a little bit differently, and a lot of that is through the leadership and the guidance of Dr. Tasha Golden, who spent some time with us as a professional teaching artist, saw the work we were doing, and then led us this way. So I'm excited to share a little bit of a different approach. As Dr. Allen mentioned, Project Jericho is a program of Clark State, and we were founded in 1999, but we are primarily funded through contracts from our Clark County Department of Job and Family Services, as well as our Clark County Juvenile Court. So from the start of our organization, the dream came from community leaders who wanted to see that the arts were accessible and a strong component in more of our community's lives, especially families and youth who otherwise didn't have access to the arts. So as a result of our funding sources, and we're turning 25 this year, so we were founded in 1999, but we continue to prioritize the referrals that are sent to us by social service agencies, by our juvenile court, straight from the judge or probation officers, from mental health providers and school officials. And as a result of who our participants are, we've created intentional programs for youth living in foster care and kinship placements who are affected by the juvenile justice system, including those who are temporarily living in our own. We have a juvenile detention facility here 2 blocks away from our building. And we also recently created a program in partnership with our family treatment court, working with parents on that specialized docket who are working to regain custody of their children and gain sobriety and a life of well-being. So our programming involves hiring professional teaching artists, local, regional, national, and they co-create and co-facilitate meaningful visual and performing art experiences for our participants. Our programming is based and ongoing. It's mostly after school because we believe education is important. So our kids come to us after school, or families come to us after school. So our programming is project-based throughout the year as well as in the summer. And I would say that as I mentioned, we've always had a desire to serve. We call our participants high priority, which means we want to serve who needs us the most when they need us the most. And our first program was actually a complimentary ticket program. And it was working with caseworkers and we have a state-of-the-art performance venue here in Springfield that's attached to the college that we're a part of. And so our program began by giving free tickets to families and providing dinner, helping them problem solve transportation, and making sure that they got to experience the performing arts live in a beautiful, at the time, brand new facility. It's our neighbor. We still send families to performances year round. And from there, it grew into, we want them to experience the arts. We want them to be not just appreciators of art, but we wanted them to feel like they were participants in the arts as well. So we have created family programs where families come to us and create art together. We always prioritize the clients of Job and Family Services. We also work with, as I mentioned, our juvenile court to make sure that we are working really specifically on helping youth who have left our community. They've received care or served time outside of our community, but are returning to community. We want this to be a place that they can thrive and not just survive. So that's a little bit about where we got our start. That's a foundational program we still offer. And then we also, I will also share, we have a program called our Lifebook program. And I just share this because it's a little bit of a different way to approach integrating the arts. We knew that there's a state mandate that youth living in foster care have to have a documentation of their personal histories. And for many youth, that was a file folder or a binder. And we said, we can do better because they deserve better. And so 22 years ago, we created a Lifebook program that walks alongside youth living in foster care with their caseworkers to document and to tell and to celebrate their voice and their personal history. And that's just the way that it had to be done. It's a state mandate, but we found a way to integrate arts so that it was meaningful and healing and a chance for youth to celebrate their stories and also to build stronger connections with their caseworkers. So that's kind of a little bit about how we've been doing adjacent work to social prescribing, but through the leadership of the field guide and other national leaders, we've been able to put more words to what we were doing and a little bit validate the work that's been done for years.
Thank you very much, Lo. So, I mean, I think we can see that everyone does different things and are funded in different ways. And sometimes, obviously they need to respond to who is the funder, as Lo was mentioning. But it's there's so much variety in how people are doing this. And so I think a lot of that is really covered in the field guide as far as different ways to look at funding, different ways that people can do. So I hope people take a look at that amazing resource. So why don't we, let's start off with Vanessa again, and since implementing your program, what benefits have you seen in the community or in an individual participant? Could you tell us about that?
Oh, wow. I think one of the primary benefits have been seeing the connection between the arts and culture community, bring awareness to our health partners. And so oftentimes we see that the healthcare field has their own solution, to things, their own way of doing things, not particularly persuaded or influenced by arts and culture. But since the pandemic, we realized that they had an open heart, an open mind to how arts and culture can impact public health and wellness. So we just grabbed the opportunity. We felt like this was the moment to really elevate the idea that the arts can impact and can heal in various different ways, and bring us to a place where we can say our community has moved the needle on wellness, specifically through implementing tools that the arts has a healing benefit. And so we were able, through this program, of even just sharing the idea of prescribing the arts with our physicians and our local clinicians as a way to promote something that's non-medicinal and offers opportunity for their patients to find wellness in untraditional ways, non-traditional ways. We wanted to promote the idea that you can write a prescription for your patient to sit in on a music class or to participate in a drumming class to de-stress and to help with anxiety. You can prescribe an opportunity for them to be a part of a painting session, just to be able to have writing skills that help you cope with your daily feelings of depression and anxiety was something that was very exciting to our local clinicians. And so the benefit, I would say, of building that cross-sector partnership with our health community has been so key, because we were able to get them to even see that there's a possibility to bring healing and wellness to their patients by linking up and partnering with the arts and culture community. And our arts and culture organizations in Springfield, Massachusetts, are thriving. And we have the ability to bring opportunities for wellness into various different spaces. We pop up in different spaces, unexpected places, to share the arts in different ways by having interactive community projects. We have the opportunity to bring live painting right into spaces that were unexpected, whether it be small concerts, different venues where we can bring live musicians, and it really does impact our souls. And so the benefit of having this program really caused us to reach into the healthcare field, gave us the opportunity to talk to our public health officials and our physicians in a way that allowed them to see that there are alternative ways to bring wellness to their patients. So that was huge. It really was huge. And then the opportunity also to just expand our community reach. And so we can't be afraid to step into uncharted territory, right? We have to find a way to reach the untapped resources that we all can benefit from. And so through this arts and prescription program, we were able to find a way to improve mental health and wellness through having opportunities of talking and gathering and sharing. And I think that there's more ways we can really develop the more we reach out. And so it's comfortable to stay in our spaces where we kind of solve the community needs with our partners that we're familiar with, but it's wonderful. And I think the outcome is so much more improved when we can bring more partners in to solving the challenges that we all are facing. And that collective impact is felt when we really do tap into the resources that each of us has to offer one another. So I'm thankful for this model, because we're able to see how it has changed and impacted even the local physicians that serve our community every day.
Thank you so much, Vanessa. That's amazing. Crystal, how about you as far as benefits you've seen to community or individuals?
Well, I've seen ArtsRx member express joy about observing a show or participating in an arts activity that they wouldn't have been able to have access to due to financial constraints. So I think of like this one grandmother taking her 2 grandchildren to the ballet for the first time. And one of our members got to create a mosaic candle holder at a glass working workshop called Glass Roots, an organization in Newark. This is really amazing. We've also received text messages from our ArtsRx members expressing gratitude that they were able to actually bring guests with them and to have a sense of pride and excitement that they were able to create something through the ArtsRx program. But my favorite benefit actually is the increased collaboration that we've had experienced between NJPAC and local Newark art organizations. Our partnering art organizations are always happy when we send them new members their way, and we work collaboratively with them to improve our ArtsRx program offerings as well. So you see that individual benefit as well as that community impact.
Thank you very much. And how about you, Lo? What have you seen in your program?
Crystal said that well, like community impact and individual. One of the focuses that we've had here in Clark County is creating programming that is specifically designed for teenagers. We have some, probably like many of your communities, we have some pretty alarming statistics surrounding youth mental health and wellness. So some research that was done in our community 2 years ago shared that 20% and 26% of our middle and high school students, respectively, we were seriously contemplating or thinking about attempting suicide in the last year. And those numbers were upsetting and unacceptable for us at Project Jericho. And so we said we have to do more work about this. We've got to create more avenues to mental health resources and give kids a safe and a brave space to belong to. And so we sought out a grant from our Community Health Foundation. So it's the foundation that is attached to a regional hospital here in Springfield, Ohio. And we applied for a grant that we were awarded. I think this is the 4th or 5th year that we've been awarded that grant. And it allows for us to pay a mental health professional their hourly rate to be here weekly at programs to serve our teenagers. And sometimes that looks like, group discussion or some like psychoeducation happening, but also he happens to make art right alongside them, and he's been able to mitigate or help us in a crisis. He's been able to connect youth and parents to other resources in the community to best serve their mental health needs. And so it's bringing the resources to our space, to a space that our participants are familiar with, that they feel comfortable in, and then utilizing the community resources that we have. I think sometimes there's resources out there, but the right people aren't getting to them. And so we try to be a bridge whenever possible. And we're fortunate that we also have an external evaluator that we've been working with for the last 8 years, who we do collect pre and post surveys. And then also we give chances for testimonials, because like Dr. Tasha Golden said, you have to get creative with how you collect your evidence and how you tell your story of what good is happening. But we are asking our youth, we're using some scales to measure their hope thinking and their mindfulness skills and their self-esteem, along with a few others. And we've seen that 45% of them are increasing their hope thinking, 44% of them have improved mindfulness skills, 48% have increased self-esteem. And that's teenagers able to self-identify, which a lot of times we know in art, what we're doing is we're doing preventative work, and sometimes you don't get to see all of the fruits of your labor. You just plant the seeds, and you hope that the rest of the community waters and is a part of their growth. But I think about just creating a sense of belonging, and also more connection to community. I think that when you feel like you're contributing to your community, you're not just taking resources, but you are contributing to the livelihood and the vibrance of your community, whether it's through public art or getting to be an audience member, cheering and celebrating someone else who's performing. I think that leads youth and families to believing that they don't just have to survive their life, they can thrive and they can enjoy their life as well. So I think, to echo Vanessa and Crystal, I think we get to see joy a lot, and we want that to be happening more than just in our space. We want that joy to carry over into all aspects of their life. And so that is definitely one of the markers of knowing that our program is making a difference is more joy, increased joy.
Increased joy, absolutely. Thank you very much. Yeah, I mean, it seemed, just listening to everybody, one point that sticks out, and also in work I've done, is we're bringing this to people who, if you have money and you have resources, you can do these things. There's all kinds of resources for you, but we're all bringing these things to people who wouldn't normally be able to access these arts of different sorts. And that is a beautiful thing. And going for joy and going for planting those seeds is really just so important. So everyone is doing, on this panel, is doing really important work, and plus lots of pilots across the country. I want to briefly ask about challenges or barriers that you faced. All of us who have created programs know that, this stuff happens and it's challenging. So I'd love to hear briefly about what kind of challenges you've reached. So let's start off with Vanessa. Glad to have you back.
Thank you, Dr. Allen. Found my way back with Natalie's help. Thank you. I wanted to share that, we had challenges finding the right health partner and finding the right community space that had accessibility of parking, and also that was on a bus line. So we had to make sure we linked up with the community partner that had the ability to offer that to our participants. And in regards to our health partners, during the pandemic, we had extraordinary levels of impact on our healthcare workers. And so although we had potential to partner with some amazing health partners in our community, some of them just did not have the capacity and the people to help support the program. And so we had to give grace where we could, and we had to acknowledge that although folks wanted to be involved somehow, that it might not have been exactly the right time. So we had to find a way to partner up with those who could offer our participants the program with ease, because we didn't want stress on anyone. We wanted to have our health partners also benefit from the program in ways that were, impactful in their lives. And so we wanted to just make sure we were partnering up with the community, engaging our participants in ways that allow them to see themselves as helping to transform the experience. They were leading us in how we were able to shape our session. Well, we realized we needed to allow space and time for folks to talk. We didn't do that first. We thought it was all about getting moving and dancing, when we realized they really needed a little bit of meditation. We needed to transform the space so they could have mindfulness time and downtime to really just express how they were just feeling being together. And so we had to really listen to the needs of the participants and then make those changes accordingly. Because out of respect for them, we wanted them to tell us what they needed. And instead of us telling them, this is what we're offering you, so just enjoy it, right? No, we needed to listen to the needs. And so when we learned to navigate the space that was really something that they had invested in and could own, we were really proud to say that this session was formed out of the need and out of listening to what folks want. So the challenges can be us. We can be a barrier to making it a successful program by just not listening to the needs of the participants, and also just transforming the community by just acknowledging there's some spaces that we want to go into, but they might not be able to join us in this space. But the train keeps moving through the community, and there'll always be an opportunity for folks to get in where they fit in. So we keep the door open. We keep our hearts open to re-engaging with folks that we try to join up with and partner with in the past. And there's no. I like to say that we always offer a way in for folks to be part of it, and when as long as they're willing. So thank you
very much, Vanessa. Yeah, that's awesome. Let's move to Crystal. Hear about any kind of challenges you've faced.
I resonate with Vanessa said. I think, like you said before, the most valuable thing I've learned implementing this program on arts on prescription models just has to be participant centered, right? Listening to the participants and making sure that human connection is formed in those moments so you can get more information from the participant and really shape our arts on prescription models to serve who it's meant to serve. When we first started this pilot of our arts on a prescription model, we worked directly with Horizon's Neighbors and Health program, which covered the transportation costs for their Horizon members. So as we transition to expanding ArtsRx at Horizon, we're now working with Horizon's larger behavioral health team. We have to explore different funding avenues to cover transportation for their members. So that's one challenge that we definitely we're facing now. Another challenge that we're facing is making sure that we provide a tailored onboarding experience, marketing materials, and support for each new referral partner that comes our way. For example, last month, we just opened ArtsRx to our Rutgers University Newark students, and our ArtsRx member type for our students is different than the traditional Horizon member. So to address this, we had to update all our onboarding training materials, marketing materials, potential ArtsRx member identification tactics, and check-in support systems for our new Rutgers University partners. And our last challenge that we're navigated, but thanks to our tech team, it's been super awesome solving this challenge actually, was adjusting how to maintain structure as well as flexibility simultaneously as ArtsRx expands. We've addressed this issue thanks to our IT team internally at NJPAC, who have created an ArtsRx Salesforce infrastructure that we have to view, onboard, and track ArtsRx member progress throughout the program in an organized, systematic way. It really allows us to see big picture, any trends and data using our Salesforce system, which better allows us to tell our story, right, to our local art organizations and potential funders for our ArtsRx program as it grows.
Thank you very much, Crystal. And real quick, Load, we're kind of running out of time, but a quick challenge that comes to mind?
I would say a challenge that we have faced is just being taken as seriously, viewing Project Jericho or access to our arts programming as a necessity, not just a luxury or a reward. Whether it was parents trying to take it from their children, feeling like, you know, they're not doing X, Y, and Z at home, so they can't come to Project Jericho anymore. Or if we're inside our juvenile detention center and a kid has a behavior and loses rec loss or is on a higher level of security. And we leveraged things like the field guide and research, national research and regional research that backs up the importance of what we're doing. And we're not a reward, we're part of their treatment plan. So now through hard conversations, a child in the detention center cannot lose access to us because the judge said, no, we're part of their treatment plan. Even if they're on 24 isolation, they are still coming to our program because we are now viewed as part of them getting to a better version of themselves. And with parents, we build those relationships with parents so that they see that we're not something to barter with or take away, but we are in partnership with them with the best interest of their children. And so I think learning how to tell your story and not exploit the stories of your participants, but learning how, and not inflating data or numbers, but reminding your community, reminding your partners, reminding the people investing in you, your stakeholders, that this is slow and steady work, and it's not going to happen just in one generation or lifetime, but sustainable change requires slow and steady work. And it's a balance of, for me, it's in our organization, it's a balance of being patient and tenacious and leveraging those resources to tell the story that art is powerful, and it's too powerful to become idle or irrelevant in someone's life. So learning to tell your story and also fighting for your people to have access to you, I think are some of those conversations that we're still having. And one way to
we're actually going to need to finish up, but thank you very much. I just want to mention to folks, thank you very much for our amazing panelists. We're going to need to finish up the program. There's a poll too coming down, being dropped about what you might need more. There's also links about how to access the field guide. There's an upcoming Florida Social Prescribing Happy Hour coming up March 25th, 5 to 6 p.m. Eastern Standard Time. There should be a link as well. There will be a webinar replay sent to you by the end of the week. And then I just want to remind you to use the field guide. Check out Social Prescribing USA, sign up for the listserv, maybe join the community of practice. And I'm hoping that now that you've heard so much from our panelists, that you want to get involved and that your fire has been lit. So think about what you can do for social prescribing and how to grow it, and better health for you, your patients. And I think that this is a new great change for healthcare. So I thank all of you for coming. I thank our amazing panelists, and it's been great to be with you.